You need to brush your teeth.
And some of our zaddies and toasters are also notorious for not, I don't know if it's that they're not brushing or if it's old age, Dr. Diola. You have to tell me what it is, because when adults are toasting, you start smelling something that is peculiar to an age group. Is there something that happens in old age that makes you also have bad breath?
Okay, so the major culprit is decrease in saliva flow. Once you start getting older, the amount of the flow rate reduces significantly.
I've been at a funeral service, and every time they said hallelujah, I wanted to pass out because I thought they thought I was an ababaku that will follow the dead into this grave. The stench from this guy's breath. They say they are fasting. Tell us about that. Welcome to Smile Stories podcast, where we talk about anything concerning the mouth, oral hygiene, the teeth, the tongue, the throat, anything that causes esophagus. With me today, I have Dr. Diola of Ridge Dental and Dr. Nosa as well. We must show teeth.
Cheese.
Hello and welcome to the show.
Thank you.
I would like to start off, first of all, where I feel my pet peeve lies. Halitosis.
Okay.
Smelly mouth.
Okay.
Please, could you tell us what we all know as mouth odor? Could you tell us what tends to cause it? How we can prevent it? You know, just a general line of education for those of us that don't know. We think brushing of teeth is all we need to know.
So, halitosis is what we call mouth odor normally in everyday language. The causes can be from within the mouth and from outside the mouth. So it's called intraoral and extraoral. And some of it is psychological. So there is no basis for it, but the person just believes
That
they
their
have
mouth
it.
stinks.
Yes. So causes like within the mouth, you don't brush your teeth properly, you have plaque or calculus or some deposits, you have a very big hole that is trapping food and bacteria.
Which is a cavity, or it might not even be a cavity.
So I'd rather call it a hole,
A hole.
a deep crater.
Okay.
Where food and bacteria gets trapped.
Okay.
Sometimes it's what we call physiologic halitosis. In the morning when you sleep, overnight,
Yes.
you wake up. I don't think anybody wakes up with fresh breath in the morning.
No, not the first one. Not the first one. It blows my mind away.
Yeah, everybody's mind, literally. So you have that.
Yes.
Then you have causes outside the mouth. So some people where they have like maybe throat cancers
Yes.
or cancers in the antrum, you know,
Yeah.
or like some diseases in the gastrointestinal, yes.
Okay.
Diabetes as well.
Cause mouth odor.
Ketosis, then diet. So if you eat a lot of garlic, or when we take blood tonics or some drugs or antibiotics, you know, things like
cause
that
it.
can cause it.
Okay, and so Dr. Nusa, you have kids that are still in school, aren't they?
Yes.
And do you ever experience, as most mothers do, because I say that I have a son, but when he was younger, anytime he was about to become ill, his mouth just started stinking. And I noticed that he was about to, fall into an illness. Could you tell us what the cause might be, and anything else that you know that is peculiar to children that causes their form of halitosis?
Well, first things first, in the morning, as she said, the psychological one, where you wake up in the morning, have bad breath. That's only normal because salivary flow has been, slowed down overnight.
Okay.
So outside that, when your kids come up with, it's linked with,
illnesses.
reduced, yes, their immunity has dropped. So when you have that, they start having bad breath. It could either be a cold, sometimes they have the cough, catarrh linked together. That gives you an accumulation of mucus in there and can, come out as the bad breath as well.
Yeah.
So yes, when the immunity drops, it leads to kids having that bad breath.
Aside from that, nothing else causes, you know what I mean?
Of course, they don't brush.
As
For
they should.
children,
Yes.
there's always, I have a daughter that's
Doesn't just
my
want to
my
lose the
second daughter
toothbrush.
is just something else. We have to keep going on about it. You need to brush your teeth. You can't just wake up in the morning and assume that it's going to be
Reminds me of a
okay.
little sister that I had that used to want to go to school and they'll say, have you brushed? And she'll be like, they caught me again today. She just didn't like it.
And it's obvious because you have that plaque, that soft, that the deposits that you have to brush off.
The milky one.
Yes.
Yeah.
Yes.
So it's obvious. So once I see it, I'm like, you have not brushed your teeth. You have to go back in there.
And
So,
scrub a little bit. Right? Yeah.
so kids are notorious for not brushing.
Okay. And some of our zaddies and toasters are also notorious for not. I don't know if it's that they're not brushing or if it's old age, Dr. Diola. You have to tell me what it is because just like it's peculiar to children,
Yes.
when adults are toasting you, you know, I'm a mature single woman. When adults are toasting you, you start smelling something that is peculiar to an age group.
Yes.
Like Yorubas would say, I want monoruma law, quarter to grave. Is there something that happens in old age that makes you also have bad breath?
Okay, so the major culprit is decrease in saliva flow.
I see.
Once you start getting older, the amount of the flow rate reduces significantly. That alone is enough.
Okay.
Yes.
Anything to change it?
Well, there are saliva substitutes. Keep your mouth hydrated. So chewing gum helps. Taking like mints
Yes.
helps.
Okay.
So anything to just encourage,
Keep it
to
active.
keep it wet, to keep
Yes.
it moist.
Yes.
That goes a long way. Aside from that, our daddy
Yeah.
they don't like going to the dentist.
They
So-
like carpentry teeth. They start with the dentition. Like I've always joked, oh, we need 3 sets of teeth. God should have given us 3 sets of teeth. Because apart from the milk teeth and that one that we have in adulthood, we need
Another
quarter
set.
to grave
Yeah.
dentition set.
Yeah, we could do
And-
petition to God.
We could.
Again.
But what do we then tell adults? Because I've been at a funeral service and every time they said hallelujah, I wanted to pass out because I thought they thought I was an ababaku that will follow the dead into this grave. The stench from this
It's
guy's
bad.
breath. And then they say they are fasting. Tell us about that.
So when you chew,
Yes.
it elevates your saliva blood flow. Everything most times just boils down to drop in saliva. So when you don't talk usually when you fast, your mouth is closed.
Yeah.
You don't chew anything. It would help to take sips of water, just little
to
sips,
wet it
just
a
to,
little.
or even chew gum. It helps. I don't think that there's much you can do about the fasting thing. So it's just to
Encourage them to
Encourage
think of
them
their
to
fellow
think.
brethren and
Yes.
sistren
Yes.
before they suffocate us.
Yes.
Now,
Also, they need to visit the dentist every 6 months. They
Every
need to
6
They need to clean out all that calculus. So most times that's a major culprit of bad
do you
breath.
also, I guess we'll come to it later, about payment schemes that will make things easier for people to be able to see their dentist more often because the cost of living and the cost of everything makes everybody feel dental care is the least of my worries,
Yeah.
right? Now, talking about general myths, dental myths. It may be a tongue twister for me, but I think you know what I'm trying to say about people losing teeth in pregnancy, losing teeth. When your tooth just falls off and the bridge or the root is still in there. I've had that happen to me twice. The roots was still in there and the tooth just fell off.
Okay.
What could it have been?
Was there trauma?
Not at the time I was chewing chocolates.
So when you have decay, sometimes when the decay is extensive,
Yeah.
there's a weak part, there's a weak spot, and it just
Chips off.
chips off, and then the rest of it is left.
And there are times where the new tooth has made the one on the outside weaker.
So when you're having tooth exchange, which is between the baby and the secondary tooth,
Okay.
it is supposed to make the baby tooth weaker.
Okay.
So it
it could
erodes as it is coming down for the upper teeth. It's eroding the roots of the baby tooth. That's why it's a little piece
Yes.
that we see and it gets wobbly and all
Yeah,
of
yeah,
that.
yeah.
But when you don't have that, then it's other reasons if you have any form of root retention.
Now, we've spoken about a little bit about halitosis. As the seasons go by and as we have more episodes, we will delve into it deeper and deeper and give more technical reasons for it. Something else I wanted to ask about is the need for dental cosmetic surgery. Did I use the words right? Cosmetic dental surgery. Or how do I say it? You know, when you are a wealthy human being or someone that is in the public eye,
Yes.
and you tend to wear designer shoe, designer bag, designer everything, but your teeth do not show this sign of good living. I, for one, don't understand how people can be going through life day in, day out, and they don't know that their smells alone tell me that you really don't care about yourself. Forget the designer brands that you want from head to toe.
Yes.
So how do we educate people more about a smile speaks for you?
Yes.
A good smile with good teeth.
Smile. To buttress your point,
Yes.
it's actually standard practice to be on the Forbes 500 list and have dental work done for your headshot.
Yes. Oh, they ask for it.
Well, they don't ask, but it's just like an
expected.
unwritten rule. I mean, you can't. I mean, you have maybe a number 40 or 30 in the world list of billionaires.
Yeah, you say I
and
never
then when it's
expected
your
it.
turn to smile, you know,
You
an
have rotten
accident.
teeth.
So you can't do that. I think it's taken us a while to catch on in this part of the world because in Nigeria especially, the slogan is just have money.
Everything will fly.
You know, nobody wants to know whether you look good, whether
I teach you want they look or you want to see my money.
You get.
Yes.
But we're getting to that point where your general aesthetic matters.
It does.
Your overall appearance matters. And people don't realize that when you've had dental work done, without doing anything else,
it gives you a facelift.
So the 10 years younger show in the UK, if you notice, every time there is a transformation, it's when they've had their teeth done. Even before the makeup, even before the
because it helps your bone structure keep your face back in place.
It restores balance and harmony to your facial structure. So yeah, I think we're getting there. And I also think that there's also the issue of time.
Yes.
So a billionaire doesn't have time to go sit in the dentist office.
But he can't fit himself for jewelry.
So we have to make the connection between maybe making more money and how your smile looks. The moment that link is made.
Because I've had a billionaire sit next to me with very bad skin, and I said, "Sir, you may not realize, but your skin doesn't show the caliber of who you are." And he appreciated it. We sorted it with 2,000 naira. Doctor, I mean the cream. Dr. Nosa talking about this thing that we all keep shining. You can see my, it's not funny, Dr. Diola, you know I'm working towards it. You can see my teeth. I'm getting older. I'm well over 50. Well, not well over, I'm over 50.
Yeah.
And I keep saying that I want my teeth tighter.
Yes.
I think you explained to me the other day that because I had a few missing, it allowed the others to spread out a little bit more. So what would be the first thing for me to do to start putting them back together so that the teeth look tight? In certain pictures, they look fine. In other pictures, they look like jaws.
It's not that bad, Miss Lady.
Dr. Diola, what is paining everybody that they would know? Is it that will say that?
Is the question for me or for Dr. Nosa?
Whoever wants to take it first. She has tight teeth. Let us go to
her.
Funny enough, I didn't do anything about them.
You're blessed.
I'm just blessed that way. Okay, so to start with, if you want your smile to be, it's a whole workup. The dentist has to assess you, and those things have to be taken. Everything has to be taken into consideration. For instance, if you want them really close up together and well arranged, you are going to be seeing our orthodontist. So it's going to be braces, it's going to be Invisalign, aligners, or, just to get them to be properly aligned. Then if you can, for the smile makeover, we do a lot where we're coming from in our clinic. So we go a step further. After you've had them well arranged and you want their color to really look, pop out, then we go on to the cosmetic. We'll go on to the cosmetic.
I know, but that's why we need
you can have veneers or crowns done. Yes.
It's a cycle.
Yes.
It's a catch-22 kind of thing.
It is.
So back to What would be the next one I want to talk about now? Because I've spoken about the teeth. I'm jealous about people's teeth when they fix it, but I can't stand metal braces.
Okay.
I just can't stand it.
Okay.
I don't like the amount of time it takes to clean it out or whatever. So what are my options?
Aligners.
Aligners.
What
Are
we call
they
Invisalign.
invisible?
Yes, so they are clear, transparent plastic, specialized plastic trays. You wear,
Trays.
yes,
Okay.
you wear them. It's something similar to what boxers wear, like
When they're
mouth guards.
guarding their mouth.
Yes, but not that thick.
Okay.
They are pretty thin, and then, like I said, specialized trays, so they move your teeth.
Okay.
So you wear one tray for X number of days or weeks, then
push
you
some
move,
in and
yes,
out, and then you get another
yes.
set.
So it moves, and then you wear the next tray, then it moves again,
Okay.
So that would work for you.
For someone like me who
Yes.
doesn't like
Yes.
metal braces. And well, maybe it's money that makes people wait, but I remember being abroad, every time we wanted to get kids to have their teeth done, the dentist over there used to say, wait till they're after 12. When they've turned 12, then we can start assessing the teeth, but not a moment too soon. Why would that be?
Well, I think for the 12 is it's not a fixed
Not
time.
a
Yes,
global
because most times before you wear braces, we want the first molar to be out, and the first molar is it comes out around 6 years old, 6 to 7. Earlier these days, even 5. So we want it properly seated. So we wait till like 8, 9. And if the child has changed all their the baby teeth
to the permanent
teeth, then fine.
There's no point waiting.
There's no point waiting.
So why would the 12 be a guide? It's for
12
a country, may not be global,
Yes,
but
12
I'm just
says
wondering.
12 only tells us that all notwithstanding early erupter or late erupter, by
the time you are
12
everything
all
should
the
be
you
sorted
should have
and settled.
exfoliated all your baby teeth. That's it.
Okay. So now we've spoken about spaces in the teeth. Let's talk about the tongue.
Okay.
That's our culprit in the mouth that can spoil relationships without giving warning. You know what I mean?
Yes,
I mean,
I
you
do.
could have all the teeth as beautiful as they are, but that tongue that people
Yeah.
just don't realize is
Yes.
very important for dental hygiene.
Yes.
Introduce us to this tongue.
Let's give some respect to the tongue. It's actually the strongest muscle in the body. Yes. So, and the tongue is not an organ we can control consciously.
Okay.
Yes. So I need to state that clearly.
General President
Yes,
upon the
please.
nation to the tongue.
So the tongue has different zones. Our tongue is the organ that tells us about the taste. So sweet, sour, salty, and what's the last one? Bitter. Yes. You actually have zones.
Yes,
It's zoned.
I
There's
can
a
remember
map
that in
on the
biology.
tongue. Then it has what we call in projections and spikes.
Yes.
Okay. It is those spikes that trap food and bacteria in between.
That gives you
Why a tongue scraper is
Yes.
good to use.
Or even your toothbrush with toothpaste.
Yes.
You can scrape. Now, the issue is we have the anterior 2/3 and the posterior 1/3. Am I getting it right? Or is the other way around?
To learn
That's
it
the
together.
right
The back of the tongue is where most of the damage happens.
The stench
Yes.
stays. Okay.
Yes. So we call them volatile sulfur compounds. That's where if you don't clean the back properly, it releases those gases.
But you know, Nigerians, if they don't scrub their ancestors out of that place,
Eh.
if they don't go, they don't
eh,
believe that they are brushing the teeth. It's true. Even I don't believe I've
Yes,
brushed my
if you've
tongue
not
well
cleared-
until I have done.
Yes.
Yeah. And then there's also for me, I don't know if it's age or something else. When I was younger, my tongue used to stay pink.
Yes.
Getting older now, most times when I'm looking at myself, it's as if it's just white, and it's not white out of dirt too.
Or sickness.
Yeah, so why the change?
Age-related changes. Are
Menopause.
your teeth as well? So what about men that are not? Are they pausing?
Men no play.
So I think
Men no
it's
play.
just age-related
It's
changes.
the men that pause us now.
It's
you know?
where it's wear and tear
Okay.
over time.
Okay.
You've used it for so long. The topography
Yeah.
will change.
Okay, so there's
Yes.
nothing I can do about it.
No.
Because I've seen
And no
myself in
amount of
videos that
scraping
would make a
make
difference.
it pink
Because I've
again.
almost bled myself to death trying to
Please,
get it
no,
pink.
no, no.
Or thinking I'll take pink drinks and let it just stain it and let it
Well,
stay there.
well, that could work.
How are we doing? So before we go, I need you to give me 2 tips on whatever topic that just seems to be what comes up for you on a regular basis, and you'll do the same as well.
Okay, so for children, one thing is clear: they need supervision. You want kids to have good breath. Make sure you supervise them. They brush first thing in the morning and last thing at night. And as I said, you need to visit the dentist every 6 months to have all your calculus and all that cleared out of your teeth.
May
Thank
the
you.
money exist for the visits every 6 months. Dr. D, give us 2 tips that you
2.
seem to be concerned with all the time.
Please use fluoride containing
Tell
toothpaste.
them at home to use it.
Please, and please.
Begging.
Fluoride containing toothpastes are essential for us in this part of the world. We do not have the luxury of fluoridated water. We don't take fluoride supplements. We don't have any of that. So the only protective barrier that we have is in toothpaste.
Okay.
It is absolutely essential for those of us in this part of the world to have fluoride in our toothpaste. Secondly, because we have kids that are now, in fact, even adults, we have a predominantly Western diet.
Yes.
Everything has sugar in it now. Energy drinks, fizzy drinks, juices, everything, snacks, biscuits, everything. So please,
we love the most.
the fluoride, the little fluoride in your toothpaste is important and essential.
And I think in one of the upcoming episodes, we're going to talk about the pros and cons of chewing stick vis-a-vis toothbrush. Because when we stick with organic things, they seem to used to work for us until Oyinbo brought on this other thing. So that will be one of the things we're going to talk about. You can send questions to us.
Yes.
You can tell us whatever your concerns are and let us research it for you and talk to you about it. Because what may concern me and my teeth is facing. Yours may be different. And if you want your wedding pictures to be perfect, if you want your headshot for your Form 500 pictures to be perfect,
Fortune 500, not Form 500.
you will not know one of them, Dr. D, because if I was, I would get it wrong. We will get there. So join us next time on Spoils Podcast, and we'll see you soon. It's called Smile Stories.